My name is Giuseppe Saglio. I'm working as a hematologist at the University of Torino. I'm professor of hematology and responsible for the division of hematology. And since many years, my main interest in both clinical and research field is represented by chronic myeloid leukemia, CML.
Hello, my name is Giora Sharf. I'm from Israel. I'm a CML patient for more than 17 years. I'm an advocate, and I am the co-founder of the CML Advocate Network, which is a group combining more than 115 CML patient organizations from almost 90 countries. And it's always nice to see you and speak with you. You know that when I was diagnosed more than 17 years ago, I was told that my life expectancy is about 3 to 4 years. And this has changed with the new TKIs that came out since then. And life expectancy of a CML patient today is almost like a normal person in the population. But there's a new concept coming out today, and many patients are very excited about it. It's called Treatment Free Remission, TFR. Can you please explain to us what is actually TFR?
I think that TFR could be defined as long-lasting remission without the need of taking the drug that was necessary at the beginning of the disease to achieve this remission. And this is an important step of the cure of the disease, because at the end we can say that TFR is really another way to say cure of the disease if the disease is not coming out after 5 years from the discontinuation.
And if I may ask you, you have patients on TFR. What is the longer period of time that you have patients who have stopped treatment?
More than 10 years. Definitely more than 10 years. They are in a complete remission.
What are the main goals, you think, for CML patient today when he starts treatment?
But generally, I'm starting just to say that fortunately enough, in nowadays we have very good drugs that can defeat the leukemia. And the first goal definitely is represented by the best possible overall survival, and to achieve again the same quality of life before the diagnosis of leukemia. And this is the main aim of our therapy. But I'm starting also to mention the possibility that maybe sooner or later we will be able also to discontinue the therapy without having a recurrence of the disease.
And who are the patients who are eligible to go to TFR?
Are patients that have obtained a very good molecular response, which means a very deep molecular response below the threshold that we define as MR4, MR4.5, which means 4 logs less with respect to what was present at diagnosis. And this very long remission, would say, should last for at least 2 to 3 years before trying to stop the therapies. And this is what we are aiming to at the moment.
What do you think is the percentage of CML patient who will be able to stop treatment or reach TFR?
At the moment, we have estimated in our center, where we're following approximately 250 patients, that 30% of them are already matching the criteria to try to stop the therapy. So I would expect that probably 20% of them can successfully discontinue the therapy.
About 25 to 30% of the patients are known to suffer what we call the withdrawal symptoms, muscle and bone pains. And how do you relate to that?
Generally, these symptoms are not extremely relevant and can be, I would say, treated with the common anti-inflammatory drugs and so on. So I wouldn't emphasize so much this withdrawal syndrome. Of course, in my opinion, is also in part a mixture of the anxiety of the patients remaining without, I would say, the protection of the drug, and the real symptoms, which are probably due to the fact that some of the function which were inhibited by the tyrosine kinases have been now reactivated. But generally they last very few weeks, and they tend to disappear during some months from the discontinuation of the therapy, and they are perceived by approximately only 30% of the patients. Very rare cases required just to reinitiate the drug.
And from the patients who are stopping, can you tell us how many patients have to restart taking the treatment because the PCR or the response, they are losing their molecular response?
It depends on when you decide to restart the therapy, if after the loss of MMR. But I would say that there is a range of people restarting the therapy in between 40% to 60% of the patients.
What do you tell the patients who have not reached such a deep molecular response and they feel like they have failed and they are not doing okay with the treatment? What do you tell them nowadays?
I think that they are okay with their treatments. The problem is they're not yet ready, and this is the last step of the therapy that we want sooner or later to reach. So they don't have to consider themselves, I would say, as a failure, but simply patients who are not reached sufficient response to stop the therapy.
So if a patient is taking a drug and he's tolerating the side effect quite reasonably and he's doing well and have a good response and he feels that he doesn't want to risk this, what do you tell him?
I think that it should be a shared decision indeed, because you cannot force a patient who is doing well just to try to stop the therapy because you are convinced. So little by little, I think that if not at this time, but maybe 1 or 2 years later, you will decide to stop the therapy. So I'm quite confident that little by little, this concept will become common among patients.
One of the issues that I think patients feel that the doctors are not relating enough to are the psychological effect of the stopping, even during the phase of stopping, the anxiety before and waiting for the results of the PCR test. How can this be overcome?
Talking to the patients, I would say. Just there should be a very good dialogue between doctors and the patients should, of course, confess and reveal to the doctor that they have this type of anxiety. But what we know that this is not a dangerous process for the moment, because out of more than 3,000 patients that have tried to discontinue, only one progression of the disease has been observed, and we do not know if related to discontinuation or some other reasons, that all the patients who are retreated are achieving again a very good molecular response.
When you are stopping a patient today, what is the standard of monitoring that you are requesting the patient to do?
The requirements at the moment are quite strict. In most of the protocols, we needed to have one PCR analysis every month for at least the first 6 months, then maybe every 2 months for the next 6 months, and so on. Coming back to the normal monitoring frequency during the second year.
Okay, and I think for my last question, I would like you to tell patients who have tried to stop and failed and they relapsed, do they have any hope for the future to stop again?
Absolutely. It has been shown recently at the ASH Congress in the end of 2016. Patients who were retreated were able to achieve a very deep molecular response. In this case, 30% of them was successful.